What I'm going to try to do, I think the best way to talk about such a broad topic is to start by talking about what happens in our body when we experience pain. And that seems like a really simple question, but it's a very complex process. And I think if we can understand what happens to us in our brain when we're experiencing pain, it will help us kind of segue into what treatments are available and why treatments are working. And I really want to try to give you a broad sense of what's available in our community, from drugs to surgical interventions and procedures to complementary and alternative therapies. And hopefully that will help us better understand how we can be active in the treatment of our pain and get some good pain control. So the definitions that you see up on your screen are the textbook definitions of pain. And I think most of us are aware that pain is an experience that happens to us when we have a tissue injury. It's a sensation that goes from the site of injury to the brain. But there's also a very complex series of parallel things that go on in our brain that include emotion, cognition, our fears about what's going to happen to us tomorrow, our past experiences that involved pain, and all of those things kind of come together and help us experience the pain and are what causes the suffering that's associated with pain. Pain is part of natural selection. It was built in as a survival technique. And so in some senses, there's a good pain. You know, if you touch something that's burning and you pull back, that's a good thing. That helps us survive. So a piece of pain is actually a positive thing. Most of us who have chronic pain have gotten past the positive aspect of pain and have a nervous system that isn't working correctly anymore. I'm going to show you a little video next that shows a tissue in the arm, actually just some skin, a pretty basic example, being damaged. And it's going to show you what happens to the nervous system, how the pain travels from the arm to the brain. I think it's a really useful diagram. You can see the tissue damage, and underneath the skin you can see that the tips of the nerves, those are the very most peripheral nerves, are being stimulated. And along those nerve fibers are passing signals that go all the way up to the spinal cord. And in the spinal cord, you have a bunch of calcium-gated ion channels that open, and a bunch of hormones and neuropeptides are released. And after that happens, the transmission can then go up the spinal cord and to the brain. When the transmission finally makes it to the brain, it's processed in a number of different areas. And that is when you actually start to put together the experience of pain and you perceive pain. And as it comes up to the brain, it's going to show you the spinal cord at the bottom, the brainstem, and then the actual higher functions of the brain. And all of those brown areas are areas that we perceive pain. All of those areas are important in our perception of pain. So in addition to actually experiencing the symptom of pain, we also have emotions that we experience when we have pain. And in order for us to put together that experience, it requires a cognitive response and a response based on our social upbringing. What moral value do we place on having pain? A great example, I think, is thirst. You can feel thirst, but what makes you think thirst is dangerous? What makes you think thirst is unpleasant? And it's a combination of things that we've been taught in our life, past experiences being thirsty, fears that we might become dehydrated or have to go to the hospital. All of that kind of comes together as we experience the symptom of thirst. And pain is the same way. What makes pain suffering is our ability to put together all of that information. And that's actually called construction. And there's a whole area of pain research in the consciousness world called construction. And here at the University of Utah, we actually have some of the best pain researchers in the world looking at how the brain puts together all of these parallel symbols. We take our prior experiences, our emotions, our cognition, our concerns about it, and the symptom of pain, and we make an experience. And that is how we contemporarily understand pain to happen in our brains. So we have the experience, the actual pain experience, our emotional response to it, and our cognitive awareness of it that leads us to suffering. And that's why we need to treat pain, because it's such a complex experience, and understanding all of that helps us understand why it's so important to treat pain. This is a great quote from Sigmund Freud. He's somebody that we all know of, and he speaks of having an operation where the surgeons told him everything was fabulous, but 2 months later he was still in so much pain that he couldn't do anything. And I think that speaks to how hard it is to undergo pain. The other reason that pain is a very difficult thing to undergo is the way it affects our emotions. Pain causes all of these emotions. I'm not suggesting that these emotions cause pain. I'm suggesting quite the opposite. We know that 65% of all patients who are in chronic pain are depressed, severely depressed, enough depressed to seek treatment and therapy. We know that patients with pain have a 2 to 5-fold chance of developing a severe depression in their life. We also know that patients with pain have anxiety. Generally, the anxiety kind of runs parallel to the pain in that we have fears about the pain. We've taken pain medication, we get anxious that the pain may return. We have a surgery, we get anxious that the pain may return. Very, very common emotion associated with pain. Anger is also a very interesting emotion, which is really not well understood because it's underreported. It's a socially kind of unacceptable emotion, and so patients don't tend to report it enough to their providers. But 70% of all chronic pain patients have a significant degree of anger. Most of that anger is towards themselves, their healthcare providers, their insurance companies, employers, etc. But some of it is also towards their loved ones, towards their community members, their religious figures. And that is a very, very bad outcome of pain. So if we don't treat pain, you can see that it's going to significantly decrease your quality of life. The other thing that we know from cancer studies is that if patients are left in uncontrolled pain, it decreases their survival time. They die of their cancers faster. And there's a multiplicity of reasons that that happens. One of those reasons is that they have poorer wound healing. They lay in bed, they get weaker, they have muscle breakdown, they get pneumonia. But we also know that it affects their immune system. Their white cells go down when they're in pain. And this is something that we've studied and understand quite well. So it's very important to treat pain. Another reason that it's important to treat pain is that if we don't, your body stays in this kind of chronic stress mode, which is good, again, going back to good pain. If you need to run because you're in danger, the stress mode is good. You know, your body kind of gets up and you help yourself. But in chronic pain, you end up with this sort of low-lying, constant chronic stress mode, which affects your entire hormonal and immune system, and your brain is adversely affected. So that speaks, again, not only to what happens in our body when we're having pain, but to why it's so important to treat pain. So taking all of that together, I now want to talk about some different treatment options that we have, and the underlining message that I can't get across enough is that pain isn't a disease. Pain is a symptom. You don't treat pain, you treat the problem that causes pain. And you have to know what's causing your back pain. Do you have a disc that's out? Do you have a muscle spasm? Do you have a problem with your nervous system? You have to know the specific